Bladder cancer is the sixth most common type of cancer in the U.S., and UConn Health Center is the only place in New England that offers up a bladder cancer support group. Joining us now is oncologist Dr. Jessica Clement. Dr. Jessica, thanks for joining me.
Oh, thank you for having me.
So I was talking to you about this during weather. Basically, it's interesting because I don't often hear about bladder cancer, and I think that's part of the problem, right?
I think that's exactly the problem. There may be a little bit of a stigma still talking about bladder cancer. You know, people don't necessarily want to talk about bodily functions, and that's a big change when it comes to treatment or symptoms.
So let's talk about these symptoms because there are several.
Yes. So the most common symptoms prior to a diagnosis of bladder cancer is blood in the urine, increased urinary frequency, increased urgency with having to go to the bathroom, and sometimes just more irritation when you have to urinate. Now, as you know, these are pretty common symptoms, so it could just be a usual urinary tract infection or, for men, prostatitis. But I think it's important that if something is not responding to antibiotics or lasting a little bit longer, it's really important to talk to your physician about it more.
Okay, and don't be afraid or don't be embarrassed. I mean, it's better to get checked and make sure that it's not something more serious.
Absolutely.
And now we have to go to this UConn Health Center support group, which I think is great because this offers support not only to people who are patients there at UConn, but you don't have to be a patient.
Absolutely not. And again, it's this community service for people with bladder cancer and for their caregivers. You know, taking care of bladder cancer is a multidisciplinary field, meaning you've got the urologist, the medical oncologist, specialized nurses who take care of wounds. But really, I think what we were lacking was patients having the ability to talk to other patients who have been in their situation, maybe giving them advice before going through surgery or going through chemotherapy. So it's been a wonderful, wonderful addition.
I can only imagine how helpful it is because sometimes you can hear something from a doctor and that's okay. But when you hear from someone who has personally gone through it, I think people kind of tend to gravitate towards the other person who they think, oh, well, they've been through it too, and they're a father of two as well, or, you know, something like that.
That's exactly right. I mean, we've even had a few patients who have a very rare type of bladder cancer who ended up finding each other. And it was great because they were from different institutions. You know, some people are getting treated in New York and coming to this meeting. And I think it really is a wonderful opportunity for people to share their experiences. So.
I can only imagine. And risk factors, that's important. Let's talk about those. There are several.
Absolutely. I think the most important thing for people to know is that smoking is the biggest risk factor. Everybody knows that smoking's linked to lung cancer, but if I could just get everybody to stop smoking because of bladder cancer, it would really reduce the numbers that we're seeing.
And patients that come in have no idea that there's even a link there, right? A lot of them don't.
I've had many people who come in and say that they had no idea that smoking could be related to bladder cancer. And I think the important thing to notice is that even people who quit, their risk does not reduce to baseline even after 25 years away from smoking.
So if you've been a smoker,
you're at higher risk.
High risk. Okay, smoking is one. What are the other factors?
So there have been other factors related to actually occupational exposure. So people who have worked in the textile industry, rubber industries, leather industries, or even dye industries. And
so this chemical exposure.
Exactly. Now, some women have always been concerned about the risk of hair dye causing bladder cancer. But what the studies are showing is that individuals who are dyeing their hair don't seem to have an increased risk. Really what the studies were maybe 2 decades ago when hairdressers or people who were really exposed over long terms with some of the harsher dyes. Okay,
so we went over some of the symptoms, the factors. Doctor, thank you so much. And most importantly, there's a support group at UConn Health Center that's available for anyone in the New England area. That's pretty wonderful.
Absolutely. And we're actually having a bladder cancer awareness picnic Saturday, May 7th for people to come by and just introduce
they're on the UConn Health Center campus. Okay, there we go. Okay, sounds great.
Thank you.
Okay, thank you so much. I appreciate it.